You are welcome to my channel. Thanks for visiting. Remembering to subscribe, listening to all my presentations and sharing them. Today I will quickly go over typhoid signs and symptoms. Typhoid signs and symptoms. But there is a full note on typhoid. So if you want to get that will take you through everything on typhoid, including signs and symptoms. You can get your glasses if you use one, get a piece of paper to jot down pieces of info on your pen, and then click on this very link. That will take you to full note on typhoid. Okay, as per signs and symptoms, we will quickly go over general info right now that typhoid is also known as typhoid or paratyphoid fever. Enteric fever is interchangeably used with typhoid fever. Enteric fever is meant to describe both typhoid and paratyphoid fever. When it comes to the clinical features, we have stages. There are 4 distinct stages, and each will be lasting at least a week. Stage 1, or the first stage, will be characterized with mild fever or no fever at all. There may be headache or weakness. Cough may be present, and when that is the case, it will be a dry cough, meaning it will be unproductive. Stage 2, or second stage, will be filled with high fever, weight loss, abdominal distension, agitation or lethargy, with or without hallucination. Stage 3, or third stage, will be more advanced. In this case, the disease is more advanced with intestinal perforation, bleeding, and shock. Of course, when there is perforation and there's bleeding, there's likely going to be hypovolemic shock, and that will also lead to dehydration. Then there will be prostration with high fever. Remember, intestinal perforation has occurred. Sepsis is right here, so high fever. Then the brain will be infected, leading to encephalitis, and of course, delirium. The fourth stage, or stage 4, will be filled with complications. Then we'll be dealing with renal failure, pneumonia, meningitis, pancreatitis. The heart will not be left out because we can be battling with endocarditis or myocarditis. Then many organs will start failing, so multiple organ failure and coma will set in. If no immediate recovery, by massive intervention, there may be death. After the causative agent would have been ingested or acquired through food or water, in 5 to 21 days, the clinical features will start and will be battling with fever, chills, and abdominal pain. In the first week, they'll be rising in a stepwise fashion of fever and bacteremia. Let me explain. Fever in typhoid is not going to be sudden. It's not going to be that, the child has been walking around and then nothing, apparently fine, and then suddenly there's fever, and the fever is now 38 or 39 or 40 degrees Celsius. No, it's going to be as if you are climbing the ladder. Okay, so going up gradually from 37.5 to 38.5 to 39, then 39.5. Now can take 2, 3, 4 days rising, in a stepwise fashion, as if you are climbing up the ladder. Then chills are typical here, but rigors are less occurring in typhoid, and the heart rate may drop, bradycardia. In the second week, then abdominal pain will set in. Rose spots could be seen. which are salmon color markings on the abdomen and trunk. In the third week, we are getting into more serious trouble with enlarged liver, hepatomegaly, splenomegaly. There may be intestinal bleeding, then intestinal perforation at the ileum. Then peritonitis will set in with bacteremia. And of course, that will lead to sepsis, right, and septicemic shock. And then utter level of consciousness. With all this, many organs will fail, multiple organ failure, then coma or death. After 3 weeks, going to months, then there will be a resolution that will begin gradually. Remember, the trouble will also start gradually, so also will the resolution be. The other time I said the fever and bacteremia will be like step wise fashion, as if you are climbing up the ladder. Now, the resolution will take the opposite direction, but in the same form. So it's like you are now descending down the ladder. So the resolution will begin gradually. Older adults will have constipation more than diarrhea. Diarrhea will be more than constipation in any adult with HIV and in children and all young patients with typhoid. Abdominal pain with distension will occur at this stage, and there may be rectal bleeding. Intestinal perforation is more in adults than children, leading to more mortality. Still on clinical features, I would like to explain further on intestinal perforation. So I've written here, ask me. Do you know what? I'm not going to take your time. There's a full presentation on typhoid, and there I've given the detailed explanation on what could have led to intestinal perforation. So just sit back, click on this very link, and you'll get the full explanation there. Now, neuro issues in typhoid will include headache, sleep disorder, or altered sleep pattern. If you click on the full note on typhoid, there I've explained that there was a time we had a patient that came down with typhoid, but then we ran into insomnia, and then we started looking for medications to help in that manner. Okay, that may be acute psychosis, so be careful. Don't mix this up with cerebral malaria. There's a separate presentation on cerebral malaria, and then you can check that out. There may be myelitis, rigidity, meningitis, hyperreflexia, spasticity, sustained clonus. This is upper motor neuron lesion, right? There may be ataxia, even Parkinsonism. There may be typhoid encephalopathy characterized with delirium, altered level of consciousness, confusion, obtundation, stupor. You can use antibiotics with dexamethasone here. Yes, you can use that. You will get further information on that when you click on that link to give you full info on typhoid. Other non-intestinal problems that we may encounter in typhoid include cough, pneumonia, febrile seizures in children, arthralgia and myalgia, and certain symptoms will be profound in HIV patients. If you want to know them, click on the link already provided, you'll get details. Chronic carriers. No recurrent symptomatic disease in them. They are chronically colonized. They have high serum antibody titers against V1. The pathogens are kept in the biliary tract, so may excrete large numbers of organisms. The chronic carriers are capable of excreting the microorganisms in stools, urine, up to and even greater than 1 year after the primary acute infection. The chronic carriage will occur more in women. Why that? Okay, you understand now that patients with cholelithiasis and other biliary anomalies can become chronic carriers. And who are the categories of people with cholecystitis the most? Of course, women. Carriers that are water or food handlers will likely infect more people. Needless to say, right? That's pretty obvious. Salmonella paratyphi will be spread mostly by food, while Salmonella typhi will be spread mostly by water. Shedding typhi in stool for 12 months after infection is a possibility. All food handlers should be tested. The chronic carriers have increased chances of having gallbladder carcinoma because the pathogens will be hiding right there in the gallbladder. Then, if you want to help them out, you don't want them to have gallbladder carcinoma, remove the gallbladder, cholecystectomy. You may choose certain agents to deal with salmonella that will be hiding in the gallbladder. So you can go for ciprofloxacin or fluoxacin, rivampin, Bactrim, or Ceftra. Okay, this is called tremolazole, right? Bactrim or Ceftra or Cefprin. With that, I've come to the end of this short presentation on clinical features of typhoid fever alone. I have a separate presentation, looking at days, that has covered everything about typhoid fever. Thanks for listening. Remember to share. Remember to subscribe to my channel. I appreciate that.